The prostate is a small exocrine gland of the male reproductive system. It is located just below the urinary bladder, where it wraps around the first part of the male urethra. The prostate gland produces a milky fluid that is secreted into the urethra to serve as a lubricant and nutrition for sperms. Benign prostatic hyperplasia, BPH, also known as benign prostatic hypertrophy or enlarged prostate, is a condition in which the size of the prostate gland is increased. BPH is not a cancer, and it does not increase the risk of cancer. However, when it becomes sufficiently large, the prostate tissue may compress the urethra and block urine flow, causing a number of urinary problems. BPH is very common in aging men. About 50% of men have some degree of BPH by the age of 60, with half of them demonstrating clinically significant symptoms. BPH is a result of hormonal changes and is considered a normal part of male aging. In aging prostate tissue, the rate of cell proliferation induced by male hormones exceeds the rate of cell death, resulting in an increased number of cells and enlargement of the prostate. Major classes of medication for BPH treatment include alpha blockers. These drugs relax smooth muscle in the prostate and bladder neck, thus relieving the blockage of urine flow. In addition, tadalafil, a PDE5 inhibitor, often used to treat erectile dysfunction, may also be prescribed to relax smooth muscle and increase blood flow to the area. 5-alpha reductase inhibitors. These medications inhibit production of the hormone dihydrotestosterone, responsible for prostate enlargement. For those who do not respond to medication, surgical treatments are available. Transurethral resection of the prostate, TURP, uses a heated wire loop inserted through the urethra to trim away prostate tissue. This procedure has been around for a long time and is still considered the gold standard for treatment of severe BPH. In the less invasive, but also less effective, transurethral incision of the prostate, TUIP procedure, instead of removing prostate tissue, several small incisions are made in the bladder neck to widen the opening to the urethra. Endoscopic enucleation of the prostate, EEP, uses laser or electrical energy to dissect the entire core of the gland, which is then pushed into the bladder, broken down into pieces, and suctioned out. This significantly reduces bleeding, making EEP less invasive than TURP while being more effective. Different EEP procedures differ in the type of energy used. Transurethral microwave thermotherapy uses heat to cause cell death in prostate tissue. Once a popular treatment choice, this procedure is now largely replaced by newer minimally invasive techniques. In prostatic urethral lift, PUL, implants are inserted to compress and pull the lobes of the prostate apart, widening the urethra. A temporarily implanted nitinol device, iTIND, is an expander introduced into the urethra and left for up to 7 days. It causes tissue remodeling by continuous pressure, keeping the urethra open. iTIND provides similar efficacy as PUL, but with less adverse effects. In Rezum, water vapor is injected to cause cell death within the prostate tissue, ultimately leading to volume reduction. Aquablation, a robot-assisted procedure, uses heat-free, high-pressure water jets to precisely remove prostate tissue with minimum damage to nerves and blood vessels. In prostatic artery embolization, a small catheter is threaded to the artery feeding the prostate. The catheter injects microscopic beads to block blood supply to the prostate, causing it to shrink over time.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike, so do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.